Hello everyone, let's talk about pregnancy advice on the internet, because if you've ever been pregnant, trying to get pregnant, or know someone who is, you've probably seen it. TikToks, Reels, blogs, forums, influencers confidently saying, "This worked for me, so it will work for you." And as a doctor, that's where my eye starts to twitch, just a little. So today, let's walk through why doctors often say, "Please don't trust pregnancy advice online," and what we actually mean by that. Pregnancy is not one size fits all, and this is one of the biggest reasons doctors urge caution with online advice. Every single pregnancy happens inside a unique body with a unique medical history, unique genetics, and unique circumstances. Two people can be the same age, have the same due date, and even go to the same doctor, and their pregnancies can still look completely different. That's not a flaw in medicine, that's biology doing what biology does best, being complicated. Online pregnancy advice often skips over that complexity. It tends to speak in absolutes. Do this, never do that. This guarantees an easy labor. That will harm your baby. But real medicine almost never works in guarantees. What's safe and helpful for one pregnant person may be ineffective or even dangerous for another. For example, exercise recommendations can vary widely depending on a person's heart health, blood pressure, placenta location, or pregnancy complications. Yet online advice often presents a single routine as universally safe, without knowing anything about the person watching the video. Doctors, on the other hand, base recommendations on individual risk factors. That's why prenatal visits involve so many questions. Have you had prior pregnancies? Any history of miscarriage or preterm labor? Do you have diabetes, high blood pressure, thyroid disease, or autoimmune conditions? Are you taking medications that could affect pregnancy? These details matter because they change what good advice actually looks like. The internet can't see your lab results, your ultrasound findings, or your medical chart, and it never will. There's also the issue of timing. Advice that might be appropriate at one stage of pregnancy can be inappropriate at another. Something that's safe at 10 weeks may not be safe at 30 weeks, and something that's normal in early pregnancy could be a warning sign later on. Online advice rarely provides that nuance. Instead, it offers simplified rules that feel reassuring but don't reflect how pregnancy actually unfolds. Another problem with one-size-fits-all advice is that it can create unnecessary guilt. When someone online says, "I did everything perfectly and had a great outcome," it implies that bad outcomes happen because someone else didn't do enough or did something wrong. That's not how pregnancy works. Many complications occur despite doing everything right. Bodies are not machines, and pregnancy is not a moral test. Doctors aren't trying to take away autonomy when they caution against blanket online advice. The goal is the opposite: to protect pregnant people from being misled by oversimplified information that ignores individual needs. Personalized care is not about control, it's about safety. Pregnancy deserves more than copy and paste advice from strangers. It deserves context, expertise, and care that recognizes that no two pregnancies are ever exactly the same. One of the most common forms of pregnancy advice online comes wrapped in personal experience. You'll see phrases like, "This worked for me," or "I did this my whole pregnancy, and my baby is fine." And it can sound convincing because it feels real and relatable. Stories connect emotionally in a way statistics don't. But in medicine, personal stories are not the same thing as evidence, and treating them as equal can be misleading and sometimes dangerous. A single experience only tells us what happened to one person in one moment under one set of circumstances. It doesn't tell us what almost happened, what complications were narrowly avoided, or how many others tried the same thing and had a very different outcome. When doctors talk about evidence, we're talking about research that looks at large groups of people over time, compares outcomes, and identifies patterns. That's how we learn what is generally safe, what carries risk, and who is more likely to be affected. Online pregnancy advice rarely includes that context. Someone may say they skipped prenatal vitamins and everything turned out fine, but that doesn't show the increased risk of anemia, neural tube defects, or other complications that research has identified. Another person might share that they ignored certain symptoms and it was nothing, without acknowledging that those same symptoms can be warning signs of serious conditions in others. Survivorship bias plays a huge role here. We hear from the people who were okay, not from those who weren't. There's also an emotional pull to anecdotal advice because it feels empowering. It suggests that outcomes are fully within our control if we just make the right choices. But pregnancy doesn't work that way. Many outcomes are influenced by genetics, placental function, and factors no one can control. When personal stories are presented as proof, they can unintentionally shame people who experience complications, as if a different decision would have guaranteed a better result. Doctors don't dismiss personal experiences because they don't matter. Patient stories are incredibly important in healthcare. They help us understand symptoms, quality of life, and how treatments affect real people. But they're a starting point, not the final word. Medical advice is built by combining those experiences with research, physiology, and risk analysis. That's the difference between "this happened to me" and "this is likely to happen across a population." When pregnancy advice online relies solely on anecdotes, it often leaves out the risks, the uncertainties, and the exceptions. It simplifies complex medical decisions into catchy narratives that feel comforting but aren't complete. Evidence-based medicine isn't cold or impersonal, it's careful. It's designed to reduce harm, not ignore lived experience. Listening to other pregnant people can be supportive and validating, but medical decisions should never be based on stories alone. Your body, your pregnancy, and your risks deserve more than someone else's outcome. They deserve information grounded in evidence, not just experience. Social media platforms are not designed to educate, they are designed to capture attention. That distinction matters a lot when it comes to pregnancy advice. Algorithms prioritize content that gets clicks, likes, comments, and shares, and the posts most likely to do that are often the ones that spark fear, outrage, or a sense of secret knowledge. Calm, balanced, evidence-based information rarely goes viral, not because it's wrong, but because it's not dramatic. This creates a dangerous environment for pregnant people. Videos that claim "doctors won't tell you this," or "if you do this one thing, you'll avoid complications," spread quickly because they promise control in an uncertain time. Pregnancy already comes with vulnerability and anxiety, and algorithm-driven content exploits that. The more you watch one alarming video, the more the platform feeds you similar ones, creating an echo chamber that can make rare risks feel inevitable and normal variations feel like emergencies. The algorithm does not know your medical history. It does not know how far along you are, whether you have underlying conditions, or whether you've already discussed something with your doctor. It only knows what keeps you engaged. That means misinformation can be repeatedly reinforced simply because it holds your attention, not because it's accurate. Over time, this can distort how pregnancy actually works and make evidence-based recommendations seem suspicious or outdated. Another problem is that creators are rewarded for confidence, not correctness. Someone who speaks in absolutes, dismisses nuance, and presents themselves as the sole source of truth is far more likely to be boosted than someone who says "it depends" or "talk to your healthcare provider." But medicine is full of "it depends," and any advice that ignores that is automatically incomplete. The algorithm favors certainty, even when certainty is inappropriate. Monetization also plays a role. Some viral pregnancy advice is tied to selling supplements, courses, or natural solutions. Fear becomes a marketing tool. If you can convince someone that standard medical care is dangerous or insufficient, you can position your product as the safer alternative. That creates a clear conflict of interest, one that is rarely disclosed clearly in short-form content. Doctors aren't immune to social media, and many healthcare professionals use these platforms responsibly to educate and debunk myths. The problem isn't the internet itself, it's the system that decides what gets amplified. Algorithms don't weigh scientific consensus, peer review, or patient safety. They weigh engagement, and engagement does not equal truth. When doctors warn against trusting pregnancy advice online, they're not saying to avoid learning or connecting with others. They're saying that an algorithm should never be your healthcare provider. Social media can start a conversation, but it cannot replace personalized medical guidance. Your pregnancy deserves more than content optimized for clicks. It deserves information guided by evidence, context, and care, not by what happens to trend that week. One of the most overlooked harms of pregnancy misinformation online is how much unnecessary fear it creates. Pregnancy is already a time filled with questions, uncertainty, and heightened awareness of every change in the body. When misleading or exaggerated advice enters that space, it can quickly turn normal experiences into sources of intense anxiety. Suddenly, ordinary symptoms feel ominous and reassurance feels impossible. Online content often frames pregnancy in extremes. A headache becomes a sign of something catastrophic. Mild cramping is presented as an emergency. A single meal choice is portrayed as something that could permanently harm a baby. This kind of messaging doesn't educate, It alarms. It teaches pregnant people to constantly scan their bodies for danger instead of understanding what is common, what is concerning, and what simply requires observation. Fear-based advice is particularly powerful because it feels protective. It sounds like it's helping you avoid harm, but in reality, constant fear does not lead to better outcomes. It leads to stress, sleep disruption, and second-guessing every decision. It can make someone afraid to move their body, eat normally, or enjoy their pregnancy at all. And chronic stress is not benign. It affects mental health, relationships, and overall well-being. Another problem is how misinformation can undermine trust in medical care. When online advice suggests that doctors are dismissive, uncaring, or hiding information, it creates suspicion where there should be partnership. Pregnant people may begin to doubt reassurance from their healthcare providers, even when tests are normal and evaluations are thorough. That doubt can spiral into anxiety that no amount of medical explanation seems to calm because the fear has been reinforced repeatedly online. This fear can also delay care. Some people hesitate to reach out to their doctor because they've been told they'll be judged, ignored, or pressured. Others avoid necessary interventions because they've been convinced those interventions are inherently harmful. In both cases, misinformation doesn't empower, it isolates. It leaves people alone with their fear, instead of supported by a care team trained to help. There's also a deep emotional cost. When online advice implies that perfect behavior leads to perfect outcomes, it sets people up for guilt when things don't go as planned. Complications, miscarriages, and difficult births are often followed by the haunting question, "What did I do wrong?" Misinformation feeds that guilt. Even when there was nothing anyone could have changed, doctors aim to reduce fear, not dismiss concerns. Evidence-based care is about putting risks into perspective, explaining what matters and what doesn't, and helping people feel grounded rather than panicked. When pregnancy advice online amplifies fear instead of understanding, it does real harm. Pregnancy should not feel like walking through a minefield of constant worry. Accurate information brings clarity, not panic. Reassurance, context, and compassion are just as important as knowledge, and those are best delivered through trusted medical care, not viral posts designed to scare. Not all pregnancy misinformation is just harmless confusion or exaggerated caution. Some of it is genuinely dangerous. Online, there is advice that directly contradicts well-established medical guidance, and following it can put both the pregnant person and the baby at serious risk. The problem is that this advice is often presented in calm, confident, and reassuring ways, making it seem safe or even superior to medical care. One common example is the promotion of unproven supplements or natural remedies as safer alternatives to prescribed medications. Natural does not mean harmless. Many substances can cross the placenta, affect fetal development, or interact with medications in ways that haven't been studied. Dosage, purity, and side effects are rarely discussed online, yet people are encouraged to self-prescribe during one of the most medically sensitive times of their lives. Another dangerous trend is advice that discourages prenatal care or routine screening. Some content frames ultrasounds, blood tests, or monitoring as unnecessary or harmful, suggesting that trusting your body alone is enough. While listening to your body is important, prenatal care exists because it saves lives. Conditions like preeclampsia, gestational diabetes, and growth restriction often develop quietly. By the time symptoms are obvious, the situation can already be serious. Early detection is not about control, it's about prevention. There is also unsafe advice surrounding labor and birth. Online narratives sometimes glorify ignoring warning signs, refusing all medical intervention, or viewing complications as personal failures rather than medical events. While informed consent and birth preferences matter deeply, so does flexibility when circumstances change. Encouraging people to dismiss signs of distress or delay emergency care can lead to outcomes that could have been prevented. What makes this especially concerning is how misinformation often frames itself as empowerment. It suggests that choosing medical care is a sign of fear or weakness, while rejecting it is framed as strength. That false dichotomy is harmful. Accepting help, monitoring risk, or using interventions when needed is not failure. It is responsible care. Doctors warn against dangerous online advice not to scare people, but to protect them. Medical recommendations are shaped by patterns seen across thousands of pregnancies, including worst-case scenarios that most individuals never witness firsthand. The internet rarely shows those outcomes because they're uncomfortable and not shareable. When harmful advice circulates freely, it puts an unfair burden on pregnant people to sort truth from fiction during a vulnerable time. No one should have to fact-check their safety while growing another human. Safe pregnancy care isn't about doing everything naturally or perfectly. It's about reducing risk where possible and responding quickly when something isn't right. Advice that encourages ignoring evidence, dismissing symptoms, or avoiding care isn't brave or enlightened. It's dangerous. Pregnancy deserves protection rooted in knowledge, not misinformation dressed up as confidence. When doctors caution against trusting pregnancy advice online, it's important to understand what they are not saying. They are not saying that pregnant people should avoid learning, stop asking questions, or blindly follow instructions without understanding them. In fact, most doctors strongly encourage curiosity, discussion, and informed decision-making. The concern is not about access to information, it's about the quality and safety of that information. The internet can be a powerful tool. It can help people feel less alone, provide language for symptoms they didn't know how to describe, and introduce questions they may want to ask their healthcare provider. That kind of engagement is valuable. The problem arises when online content positions itself as a replacement for personalized medical care rather than a supplement to it. Evidence-based medicine is often misunderstood as rigid or dismissive of patient choice. In reality, it is flexible and collaborative. Doctors use research, clinical experience, and individual patient factors together to guide recommendations. Two patients with the same diagnosis may receive different advice because their risks, preferences, and circumstances are different. That level of personalization cannot be replicated by a video, blog post, or comment thread. Another issue is transparency. Credible medical sources acknowledge uncertainty, discuss risks alongside benefits, and adapt recommendations as new evidence emerges. Online pregnancy advice often does the opposite. It presents simplified answers with no room for nuance, rarely cites reliable sources, and doesn't update when information changes. Medicine evolves and responsible care evolves with it. Static or outdated advice can quickly become unsafe. Doctors also understand that trust is earned. Many healthcare professionals now use online platforms to educate, correct misinformation, and explain medical decisions in accessible ways. This shows that the issue isn't doctors versus the internet. It's safe information versus misleading information. When doctors push back against certain online advice, it's because they've seen the real-world consequences of misinformation. Patients arriving late to care, frightened by false claims, or harmed by avoidable decisions. Importantly, doctors welcome conversations about things patients see online. Bringing a post, video, or claim into an appointment is not an inconvenience, it's an opportunity. It allows healthcare providers to explain context, clarify risks, and tailor guidance to the individual. That dialogue is how trust is built, not lost. At its best, online information should empower people to participate more fully in their care, not to replace it. The goal is not obedience, it's partnership. Pregnancy care works best when patients feel informed, respected, and supported by professionals who are trained to navigate uncertainty and risk. So when doctors say, "Don't trust pregnancy advice online," the message underneath is this: don't let generalized, unvetted information override personalized medical care. Use the internet as a starting point, not the final authority. Your pregnancy deserves care guided by evidence, compassion, and expertise, not by what happens to trend on your screen. So when doctors say, "Don't trust pregnancy advice online," what we really mean is, don't let strangers with no context make medical decisions for your body. Don't let algorithms replace expertise, and don't let fear drown out facts. Ask questions, get curious, bring what you see online to your doctor. We're happy to talk about it because you deserve care that's based on science, compassion, and you, not the comment section.